How does in vitro fertilization, also known as IVF, work? How is it actually performed in practice? What does its success depend on? We will try to answer these and similar questions in today's episode of the series Secrets of Genes, in which I welcome you. My name is Edward Kenowski, and I work as a geneticist at the Institute of Biophysics of the Czech Academy of Sciences. When natural conception does not succeed, medicine comes into play. In vitro fertilization, or IVF, literally fertilization in glass, is now one of the routine methods of reproductive medicine. Nevertheless, it is an extraordinarily delicate biological process. It is technically demanding and socially as well as ethically debated. Since the birth of the first test tube baby, Louise Brown, in 1978, more than 10 million children have been born thanks to IVF. IVF was originally developed for women with blocked fallopian tubes, but today it is used for a wide range of infertility causes. In cases of reduced sperm quality, ovulation disorders, endometriosis, advanced maternal age, or unexplained so-called idiopathic infertility. The basic principle is that the key early stages of conception take place outside the woman's body, in laboratory. The process begins with hormonal stimulation of the ovaries. Under normal circumstances, only one egg matures during the cycle. However, for IVF, it is necessary to obtain more eggs. Therefore, the woman takes the hormone FSH for several days to weeks, which promotes the growth of a greater number of follicles. Their development is carefully monitored by ultrasound and hormonal tests. The final maturation of the eggs is triggered by administering the hormone HCG or its analog. Approximately 36 hours later, the egg retrieval takes place. Under short anesthesia, follicular fluids containing the eggs are aspirated with a thin needle inserted through the vaginal wall under ultrasound guidance. These are immediately handed over to the embryologists. Their number and quality fundamentally influence the further course of the cycle. On the same day, sperm are collected. Most often, they come from ejaculate. In cases of severe male infertility, they can be surgically retrieved directly from the testicle or epididymis. In the laboratory, the sperm are purified, and the most motile and morphologically suitable ones are selected. Fertilization itself occurs in two ways. In conventional IVF, the egg is surrounded by thousands of sperm, and fertilization occurs spontaneously. Today, the more common method is ISI, the so-called intracytoplasmic sperm injection, where a single sperm is injected directly into the egg using a microneedle. After successful fertilization, a zygote is formed, which is the first cell of the new organism. This is followed by the cultivation of embryos in incubators with precisely controlled conditions. The embryos develop for several days and their division is carefully monitored. Around the fifth day, a blastocyst forms, a structured embryo with a higher chance of implanting in the uterus. For selected couples, so-called pre-implantation genetic testing can be performed, which detects serious chromosomal abnormalities and reduces the risk of miscarriage or genetic diseases. A key moment is the transfer of the embryo into the uterus. The selected embryo is introduced into the uterus using a thin catheter, usually without anesthesia and without pain. Today, usually only a single embryo is transferred to minimize the risk of multiple pregnancies. Any surplus high-quality embryos can be frozen for later use. After about 10 to 14 days, there is a waiting period for the result. A blood test for the hormone HCG will show whether pregnancy has begun. The success rate of IVF depends primarily on the woman's age. For women under 35, it reaches approximately 40 to 50% per cycle, but it decreases significantly with age, mainly due to egg quality. IVF has pushed the boundaries of human reproduction, making it possible for life to begin outside the body, offering hope where natural mechanisms fail, and at the same time raising deeper questions. When does human life begin? How should embryos be handled? And where is the limit of medical assistance? From a biological perspective, IVF is an impressive demonstration of how little, yet how precisely, is needed to create a new human being. That's all for today. We've talked about some interesting facts from genetics, specifically about how in vitro fertilization works. We'll continue in the next episode with more interesting questions from genetics and evolution. I'm looking forward to seeing you. If you enjoy my storytelling, I would appreciate a like and a subscription to my channel. I really value your support. Thank you and bye-bye.